And also, before I forget, for the head assessment, you may also check if the hair of the patient is somewhat forming some baldness or sign of alopecia, because that will include an important information in creating or making your care plan. Then for the next is for the ears. In assessing the ears, the auricles are examined in terms of color, symmetry, elasticity, and any tenderness or lesions. The external ear canal is inspected for color and the presence of any drainage and earwax, and the tympanic membrane in terms of color. Integrity and the lack of any bulging is also assessed. So in this assessment, the doctor may ask you to hear the whisper, like about 10 meters away from your ears, and then the doctor will gonna whisper and then will ask you if what is ano yung sinasabi niya. Then if you um tas kung narinig mo and nasabi mo ng tama, your um your tympanic membrane is intact, or the nerve in your ear is intact. So, like, because I don't have any companion for this, so I'm very sorry I can't demonstrate it well. But I'm gonna explain you more deeply about in the ears. And then I also may napapanood din naman po akong video na about sa ear assessment din. That's the one way one way procedure on how to assess ears in HENT physical assessment. So for next is for the nose. So for the nose, the doctor or the healthcare specialist must consider the color, the size, shape, symmetry, kung pantay ba ang ilong, ganun. Kung ano po yung size niya, kung pango, ganito, sa akin. Then, any presence of drainage, flaring, tenderness, and masses are assessed. The nasal passages are evaluated visually using an otoscope of the correct size for an infant, child, adult, and adult pala. The sense of smell is also assessed. So, for this assessment, the healthcare provider or the practitioner will also ask you to smell some scent that you are likely familiar with, and then if you guess it right, or knock it or say it right, say the right scent of that particular smell, your nerve in the nose is intact. I'm not sure about the what nerve is that, but that is how they document the assessment for the nose. Then for the mouth, for the neck, the healthcare practitioner will consider the neck and head movement are visualized. The thyroid gland is inspected for any swelling and also for normal movement during swallowing. So for this assessment, the healthcare practitioner will consider or will ask the patient or the patient to what to ask for neck movement, like upward, downward, sideward. Then I think um sideward like that, upward. Then if the patient doesn't feel anything or any pain, then that's a good or excellent documentation for the health practitioner. Then for the thyroid, So for this thyroid assessment, the thyroid gland is not visible. So enlargement should prompt further evaluation and not symmetry or enlargement. So for this assessment, um, since thyroid is not cannot be seen by the naked eye, so such instrument or measure instrument is used um, to see if there is an enlargement or um, abnormalities of size of the thyroid of the patient in the thyroid, thyroid gland in the thyroid. So that's all. Thank you for listening, and